There we go. So I am definitely recording. So we do like everybody to turn on your cameras if you can. So a little bit about me for those of you who do not know who I am. My name is Jody. I am one of the admissions reps here at Sonoran University. I've actually been out here in the Valley in Arizona since 2002, so about 20 years, originally from South Bend, Indiana. So up there where all the snow is right now. So it's actually very cold here to me today. My hands are like freezing. So welcome to our Live with Jane and Jody. So I have been with, a little bit about me is I have been with Sonoran University, which originally was SCNM, for a total of 16 years. I celebrated my 16th year in August. Absolutely love what I do, originally from the mortgage industry. So came into SCNM at the time. Absolutely love what I do. I absolutely love working with Jane. We have the same mindset. We enjoy working with our students from the very beginning all the way up to as like Dr. Shiffler, one of our alumni. So welcome again. Just remember, this is kind of laid back for all of you. So do feel free to ask any questions that you have in the chat, or if you want to turn off your mute and ask a question. This is very, very kind of laid back, okay? But it's definitely for your information, so you can start gathering this information from our amazing alumni. So as I usually start, I usually share a core value with all of you. So today I picked We Shape the Future. The future is all of you. Jane and I work side by side with you to help make sure you are taking all the necessary courses that you will need to prepare you for medical school, and help you to become successful. You are all the future of healthcare. Okay, so that's one of our core values that we absolutely stand true to. So without further ado, I'm going to introduce my guest that's going to be joining us today. So with us is Dr. Nichole Shiffler. Dr. Shiffler started Sonoran University in 2009. So as you all know, it was SCNM at that time. Completed a 2-year residency and held the position of our residency director until opening her own practice in 2021. Her main focus is women's medicine and pediatrics. She is a mom of a very active 6-year-old daughter, and I remember when she was born. And she loves traveling and recently visited Madrid. How exciting. So let's just go on into the questions. I have some canned questions that we usually ask everybody. So I'll start there, but you guys, please feel free. This is for you. You guys, please feel free to ask whatever questions you like. Okay. So Dr. Shiffler, how did you first become interested in naturopathic medicine? Let's start there.
Sure. Yeah. Hi, everybody. Let's see. I went to my undergrad at NAU in Flagstaff. And so during that time, I was a veterinary technician. And I kind of thought I would pursue the veterinary path, but I kind of also really just kind of preferred working with people. And my initial thought, or what I really wanted to do was primary care. So that's kind of was floating around in my mind. And I think really, actually, I was at a job fair at NAU, and I don't know if it was SCNM. I think I might've been NUNM at the time who had a job fair. So I coming from Arizona, I'm going to back up a little bit more. So originally I was living in Illinois. So that's where I went to high school. Never heard of a naturopathic physician, because we're just not licensed there. So I moved to Arizona. That's when I attended the job fair, was working as a vet tech, but saw that you can become a primary care physician and also get kind of extra training. I was really mainly just kind of wanting to do primary care, but also really enjoyed working with, lots of nutrition, maybe being able to do acupuncture. The physical manipulation was kind of something maybe I was interested in, but I was really excited to find a career that you can become a primary care physician and spend some extra time with patients. So that was another thing that really kind of attracted me to this profession. And of course, at that job fair, they definitely talked about how we like to treat the cause. And so all of those things kind of really resonated with my own personal desires in healthcare and what I would want to pursue and how I would want to kind of spread the healthcare knowledge to the world. So really luckily I had that job fair there. And then I was moving down to the Valley after I graduated. And that's when I just determined to start applying.
Awesome. Very good. Now, did you apply to just SCNM at the time or to multiple schools?
I did just apply to SCNM because I had lived in Arizona, prior, and I was moving down to the Valley because all of my family lived down here. And so it was kind of, if this wasn't going to work out, I would maybe pursue another career path, but I was kind of putting all my eggs in one basket because I wanted to stay here and, I toured the school. And so I knew that this is the place that I wanted to go.
Very good. Very good. And we do have a lot of, like Dr. Shiffler and myself, I'm from the Midwest as well. So we do have a lot of people that do move to the Arizona area. Absolutely love the desert. Absolutely love the nice heat that we get in the summer. And then some that just want that change, maybe are natives from Arizona and want that change of maybe moving to more climate that is more rain or something like that. So, that opportunity is there. So, all right, let's go. So tell us a little bit about why you chose a residency first before opening up your practice.
Yeah, I was the residency director, so I will every day of my life stress the importance of having that opportunity post graduation to not only have mentorship, but to be able to be exposed to so many different pathologies that you feel comfortable, letting that pathology walk into your office and know exactly what to do. So that's what a residency affords you. It affords you the ability to see, the different ways that a pathology can present so that you feel comfortable treating that and you know exactly what to do. And then on top of that, you gain just, the ability to have those mentors available to you at any time. So I don't know if I answered that exactly correctly, but
no.
Yeah. And residency is definitely a strong recommendation of mine because we just need that extra training.
Okay. Now, talking about residency. So for one, it's not required in naturopathic medicine, correct?
Correct. Mm-hmm.
Okay, unless you're planning on practicing in the state of Utah, then you do need a 1-year residency. So how hard, let's stay on the residency, talk a little bit. How hard is it to get a residency?
It's challenging because there's not that many opportunities.
Okay.
So knowing that you want to pursue a residency initially in your career is, a great thing because then to academically perform well and build a resume that makes you seem like a strong candidate. And then you can kind of determine. I did a school-based residency. So it's a little bit different than if you did a residency at a private clinic. So if you know what direction you would like to go, that also allows you to kind of start making those connections and getting that experience that you need to be a strong candidate. Because it's tough because there's just not enough opportunity. So the reason why it's not a requirement is because we don't have federal funding to create these opportunities. So if it's not a school that's creating a residency, it's a private clinic that is using their own funds to provide salary for the resident.
Okay, very good.
And you're correct. Utah is the state that requires a 1-year residency to be licensed there. And I do think that is the trend of states that are currently not licensed, that they will put into their law to allow licensure. So again, the importance of residency.
I see. I've always been curious, and this isn't one of my questions I had on here. Do you know approximately how many residencies there are?
Well, I used to. I definitely used
just a guess.
I want to say like maybe 86 to 92, but that also includes like Costa Rica and everywhere else in the US and Canada.
Okay. So yeah, I knew there wasn't a lot. So I knew they were quite competitive. So, and you can go to school here at Sonoran University and do a residency like at Bastyr or in Washington or someplace like that, or at one of the other schools. Okay.
Yeah, that
Very
commonly
good.
happens. The challenge, the opposite direction is sometimes a challenge because the applicants are hesitant from other schools to apply to Sonoran because we have in our licensure, we're able to do acupuncture. And so
Gotcha.
it wasn't really clear that we can have a restricted license. So even if you get licensed in another state, you can still practice in Arizona. You just have a restricted license.
Got it. Got it. Awesome. Any questions so far? I feel like I'm
Yeah.
asking all of them. Very good. Thank you, Alexandra.
Hi. I have a question for you, Doc.
Yeah.
So I'm from the Midwest as well, Wisconsin, a little bit better than Illinois. So recently, Wisconsin just got like official licensure to practice naturopathy in back this year in 22. As a current having your own practice and being from the Midwest, do you see any challenges with more practices now opening up in the Midwest?
As in like you're concerned that there might be a saturation point?
A saturation, difficulty with getting started. Okay.
Yeah, I don't think so. I mean, the Midwest, so in general, we're trained as primary care physicians. In our profession, we can sit for different board specialties. So, that would be a different story. But in the primary care world, in general, we are lacking primary care physicians. So there's, especially in Wisconsin, there's rural locations that don't have access to care. So I don't think that we could reach a saturation point because people are struggling to find a provider in general.
Awesome. Yeah, it was definitely just a question of mine. I see a naturopathic doctor and she practiced as an ND by having an overseeing MD for the last 20 years. But now with the licensure change, she's one of the very few practicing NDs in Wisconsin. So it's really exciting to see other people that are excited to especially bring more naturopathy out by us. So
yeah, absolutely.
Yeah, it's definitely needed.
Yeah.
I see that there's a question.
Yeah, let's see. So Tejo asks, where did you find the information on the residency positions? And would the school have this information?
Yeah, I can answer that. And yes,
Sure.
the school would have that information. The AANMC also joined in with the residency directors a few years ago so that they could help to basically the schools and the AANMC came together and we created a portal where all of the applications you can do all your application online. And so all of those positions are in that portal. They fluctuate each year because again, all of the positions in the private clinics are dependent on the funds being available. So some private clinic residency positions might change. Same thing with the schools. There might be some change there based on budget that year. So you wouldn't know really what's available to you specifically until you're closer to applying. But the AANMC site should have all the current options so that you can take a look at what's offered now.
Right. And Tejo, I did put the ANMC website, well, www.anmc.org, and that is accredited, oh my goodness, Association of Accredited Naturopathic Medical Colleges. That's where we've got so many acronyms or whatever they are that it's like, oh my God, what's that one stand for?
Yeah. And on that website, there's a tab that says residency and a bunch of information is there.
Okay. Very good. All right, let's just go ahead and move on. So I'm curious so you did a 2-year residency, right, Dr. Shiffler?
Correct.
So when did you feel that you just opened your practice just recently. So when did you feel that you were ready to move forward with opening up a practice?
That's a good question. I think I had some life stuff, like I had a child, so like that kind of definitely put some things on pause. And so, outside of academic and clinical security, feeling that I knew what I was doing well enough to open up a practice, there was definitely some life stuff that happened there. So I can't give you like a timeline of what would be most appropriate, but things just kind of aligned. So, my child was older, the residency director position, I was just kind of more changing into more of an administrative role, and I really just wanted to do more patient care. And so that's kind of what started me thinking about opening up my practice. But
Okay.
I felt comfortable seeing patients and managing patient care, years ago. It just was a nice time for me to be able to do that now.
Very good. Very good. Let's see. So for how long after graduation can you be accepted into a residency?
Yeah, that's a good question. I don't know if there's necessarily a timeline that they would restrict you from applying. It would just probably, if you've been out 5 years, you probably wouldn't want to initiate into a first year residency position because, well, the salary isn't fantastic, and you've already had 5 years of experience, so you've already gained some skills, so you probably don't need to go back and do a first year residency. But if you were switching to maybe primary care and then you wanted to become a FABNO and do oncology, yeah, that would be a different story. And I don't think that there is a timeline that they would restrict your application.
Okay. Good question. Good question. All right. Any other? And Chloe, I'll get with you regarding your application questions that you have. And I'll email you that fee waiver as well. So James goes on, is typical residency 1 year or perhaps length depends on area of focus?
Correct to both things. So yeah, typically the residency contract is a year long. Usually you would do a second year residency if you personally wanted to focus on something more specifically. So that second year allows you to achieve that focus. In the school-based residencies, that second year you start to oversee student patient care. So like at Sonoran, you would have a student rotation where you'd be overseeing that care without another attending physician. So you would be that attending physician. And then to sit for a board exam, you have to have completed at least 2 years of a residency.
Okay. Interesting.
And board exam being in oncology, pediatrics, endocrinology. I think there might be another that's up, but I think that's all that I know right now.
Okay. Very good. Very good. All right. Do you feel like attending a residency makes you a stronger candidate for careers in clinics and other hospital settings?
I mean, yes, absolutely. Yeah. But because when you're in a residency, you have an attending physician, you have attending physicians that you work under. And so you will see a higher volume of patients that you would have been able to see in your private practice because that patient volume is just already there for you. And then you have attending physicians and mentors that can kind of guide you through patient care. And so by that volume alone, you feel more comfortable, you're seeing more pathology, you know how to treat that. Of course, you'd be a stronger candidate. But again, I was the residency director, so I am absolutely biased.
Number one cheerleader for the residency program.
Yeah.
So tell us why the focus on women's medicine and pediatrics in your private practice. How'd that interest you?
Yeah, you'd thrown that question to me, and I have been trying to think of a good answer. I don't really have a great answer.
Okay.
When I was in the program still as a student, at no point did I want to see children. They scared me, the pathologies that they can, their illnesses, like all of that was just terrifying. And then in my residency, I worked a lot with Jessica Nichole for a year of my first year of residency. And that's when I became comfortable seeing the pediatric population. And turns out I feel like seeing kids is easier because they haven't been around much, they don't have chronic illnesses. They're super fun to interact with. They always make me laugh. So I enjoyed pediatrics because just that population was more fun. So not a great answer. And then women's medicine, in general, in the primary care space, maybe as a female practitioner, I just see more women. And so I just have more confidence in those types of conditions.
Okay, that makes sense. Okay. I didn't know if that was always your interest going through school, because there are some students that, they have a certain interest before they even start, and that interest carries with them all the way through. And then that's how they, put their primary care together, so.
Yeah, I'm not a great example. There's colleagues of mine, they exactly that. They knew
Okay.
from day one exactly what they wanted to treat. And it really helped guide them into marketing themselves because everybody knows to refer to this person because this is what they're so great about. So I don't, I really just want to be a primary care physician. So I not only do I enjoy seeing pediatric patients and doing women's medicine, but I just enjoy seeing anybody.
Okay.
So, I
Okay.
just like being that family physician. My favorite is where I see the kids and the parents, together. So I have like a ton of families that I treat everybody.
Okay.
So I
Okay.
really just kind of enjoy that. And so I just, really, really like primary care, but
Okay.
that's a challenging thing to market sometimes because it's so big.
Okay. Okay. Are you in practice just you, or is anybody do you have other docs in with you?
I've got 3 other docs. So the other primary care physician is Molly Sanasuaso. And she
Okay.
does a lot of women's medicine as well. She works a lot with women with PCOS, but she also does a ton of gastro stuff. So she likes the GI conditions.
Okay.
Her and I are the primary care docs in the office here. And then I have 2 that focus on oncology. So they do integrative oncology. It's Dr. Havens, Jennifer Havens, who
Okay.
helped to create the licensure in Wisconsin, and Sydney.
Awesome. Awesome. Wow, that is great. All right. So, Dr. Shiffler, tell us what your normal day looks like. What's a normal day for you look
Yeah.
like?
Well, since I co-manage the practice with my partner, so he and I just kind of do a lot of administrative stuff. So it's kind of a mixed bag. Majority of the time I'm seeing patients, but I also do all the blood draws here. So we don't have an MA. So I do all the lab draws. So
Okay.
usually in the morning I have a few lab draws, and then I have a couple of patients, which is pretty much what happened this morning. And then in the afternoon, I'm just seeing patients then as well. So pretty much every day I'm mostly seeing patients, and then on the back end being my own MA and then being my own administrator as well. So ordering supplies, doing all the things.
Okay. Okay. All right. All right. Let's see. We have another question. Alexis, I've always wanted to go into pediatrics. How does your practice differ from an MD practice?
So we're pretty similar. I mean, in general, you get asked that as a naturopathic physician, you get asked that all the time. Like, what's the difference? So in the state of Arizona, it sounds like you guys aren't all in Arizona. So in Arizona, our licensure is pretty open. We have prescriptive rights. There's some medications that we can't prescribe, but the majority of medications we can oversee, we can prescribe, or we can order imaging, we can order lab work. So a lot of it is exactly the same as other primary care offices. But I would say what's different about me specifically, and probably my colleagues as well, is the amount of time that we get to spend with our patients. So my typical visit length can be anywhere from 30 to 90 minutes.
Wow.
And so, usually a pediatric office, you're going in for your well visit. That visit might be like 15 minutes. And then an MA comes and gets all the vitals and all the, the height, length, head circumference, all that information, but you don't really get time to sit with your physician and say, hey, I have this specific nutritional question for my kid. You don't really get that time at a pediatric office. And so, I would imagine those pediatricians would love to sit and spend more time, but they just don't have that. They're just not afforded to be able to do that because of the model that they're in. And so I get to spend an hour doing a wellness visit. And if the parents have concerns about nutrition, or they want to figure out ways to get their child to incorporate better food, or any sort of questions like that on their development, I have the time to be able to spend and talk to them.
Yeah.
So that's a major thing that I differ. And then of course our training is different too. So we have a lot more nutrition training, and then we have other modality trainings that is not common in the MD world. So I like that we just have a lot of options. So I have a patient that can come into the office and ask, this is what's going on with me. What are my options for treatment? And I can we can put together a better plan, because I can give them an option, I can give them 4 different options essentially. And we can talk about what that looks like based on cost, compliance. And so overall, they're going to be able to achieve their health goals faster because it's a plan that they feel pretty comfortable with.
Right. Right. Awesome. So is there a modality that you seem to use more in your practice than others?
Yeah, I've always been leaning more towards botanical medicine. Of course, if you consider nutrition a modality, of course, that's a huge thing. But oh yeah, I just see that question comes through. Yeah, so I would say the herbs are the thing that I utilize the most because
Okay.
and anecdotally, I've just seen the best result there.
Wow. Wow. Yeah, botanical medicine is definitely one of the more popular ones. Yeah, definitely. All right. Let's see. So I'm assuming, Dr. Shiffler, being in your own practice, you still have that ability to reach out to mentors that have maybe mentored you in your residency or even as a student and ask some questions if you stumble on something that you're not sure of.
Yeah, our profession in general, is small, and
Right.
so we all, especially if you're from SNM/Sonoran, we all know each other, and so
Mm,
I could easily call 10 different people if I needed to, and they would accept my call and be happy to talk about clinical questions. But I'm
awesome.
older now, so I'm doing that much less. I've been out in practice 10 years, so it's
Wow.
not common that I would have to do that. More so I will bug my colleagues because, I know that this person that I graduated with does like pain management, and I have this patient that came in and they've got, they tweaked their back, and I just want to make sure that my clinical thinking is correct. But yes, that
Okay.
ability I always have.
Good. Wow, 10 years. I mean,
Yep.
that's got to go fast. I mean,
Like
I'm sure you're.
20, I mean, pretty much, yeah, 20, I graduated in 2013. So yeah, this will be my 10th year in practice.
Wow, that's crazy.
I know.
That is crazy. So what is the most challenging part of being a business owner?
Probably just the marketing piece, because
Okay.
I'm a physician. I'm not a business person, but that my partner does a lot of that, so that's helpful.
Okay. Very good.
That's definitely something that I'd had to have learned. So I personally don't enjoy social media. It's not a platform that I like to utilize to connect with others.
Okay.
Probably because I'm old, but so that's something I've definitely had to learn to incorporate because it is a huge platform and a lot of people are utilizing that to get information. So that's something that's been a challenge that I'm working towards getting better at.
Okay. Good. Okay, Zarina, you have a question.
Hi, how are you?
Good.
I'm good.
Hi, so I do have a question. So my name is Zarina, and so I've been a pediatric medic for the past 10, 12 years. And so I chose to go into, well, that's my passion, pediatrics, but I chose to do ND because it was focused on healing patients like natural, like we have a need for looking at natural medicine. And so I have like a scenario question. So say a patient comes in with like some pain or a cough or a cold. May I ask how you would treat that patient?
Yeah, they're a kid?
Mhm.
Sure, yeah. I mean, let me know how old they would be. I mean, we got lots of options.
Sure, let's say they're 5 years old.
And they're coming in with so right now, definitely seeing a lot of upper respiratory illness.
Yeah.
So I personally I would just say by background, I enjoy all the information. So if it's an upper respiratory illness and it's not the diagnosis isn't clear, I would probably recommend getting a nasopharyngeal swab and using PCR testing to find out exactly what it is, because I've been tricked before. You'd have a patient come in and you'd suspect that it's just a viral upper respiratory infection, but it's some weird bacteria called Moraxella. And you might at that point determine based on the presentation of the child to treat that with antibiotics or not, depending on what's going on. So I would probably need more clinical information to give you more precise information, but I, again, have a lot of options for treatment. We've got medications, we've got antibiotics, so we can do everything that's evidence-based to manage that condition. And then we can add some other things in too. Again, like pull in the nutrition piece, add in some things that you might think would be helpful in that case for reducing any sort of, I don't know, there's inflammation or whatever, being supportive to the immune system. So lots of
Is botanical medicine, is that a major part of practice for you?
I mean, maybe. I basically treat each patient individually. And so some patients come in and they're like, no way am I going to take a herb. What are you talking about? And so we just have another option. Or some other patients are like, hey, this is a totally safe thing to use an herb for. That would be my preference for treatment. I'm totally fine with this delivery system, and I'm going to be more compliant with this herb than I am with another medication.
Okay.
Sometimes you have to use the medication. So again, we got all the options.
Thank you.
See, and actually, I mean, you said it perfectly. Each patient is a different scenario depending on what else is going on with that patient, so yeah, so that's a big part of it as well. All right. And I'm sure I know this answer here. So what is the best part of your job and why?
Of course, the patient care, because that's the whole reason why I kind of brought myself into private practice, was for patient care. So I enjoy seeing the patients. But I enjoy seeing the patients get better. All of that's fantastic. Yeah, so really, it's just patient care and just working with patients.
Very good. Very good. Which sounds, yeah, that would be a normal answer. Normal. Yeah. So is there anything that you now know that you wish you would have known before starting the program? Let's talk a little bit about the program. And I know it's been a while, but
yeah, exactly. Yeah, I mean, that was also a challenging question, because I was thinking about an answer for that as well. But I kind of feel like I was pretty well prepared and I knew what I was getting into. I would say in general, if you haven't worked with a naturopathic physician or you haven't shadowed a naturopathic physician, if you're thinking about applying, I don't know if you guys have already applied or where you're at with that, but I'm assuming you're all prospective students. So if you haven't worked with a naturopathic physician, definitely do so, because then you can, see if that's something that fits you, because it's, it's a huge commitment of your life and funds. So definitely make sure that you know that this is something that you want to do. So I'd worked as a veterinary tech for a while. In college, I was a pharmacy tech. So I kind of knew I was going to be in the medical field in general. So that was easy. And then I did a bunch of research after finding out what naturopathic medicine was, and noted that there was a lot of alignment between conventional medical training. And so I enjoyed that as well. So yeah, nothing really that I wish I knew. Yeah.
So here in Arizona, with us having the widest scope of practice, there are a lot of NDs here that practice. So for students that are coming from an unlicensed state where there's not a naturopath close to them, what do you suggest?
Yeah, I would say make that connection somehow. I mean, these types of events where you can speak to a provider, in some capacity would be helpful. Because in states where we're not licensed, that naturopathic, whatever they might be, physician or not, can look totally different than someone who is licensed. And, we have different opportunities. So as a physician, that's going to be different than someone that might be just a naturopath. So make sure you're actually connecting with someone who's graduated from one of the accredited colleges and is working in a state where they have the licensure of the state that you would like to practice in. If that makes sense.
Very good. So Chloe asks, were there any downsides to the program or anything you would change about the school? Good question.
I really enjoyed my class. A lot of us are still really close. So that was always a benefit. I mean, it would have been great to have had even more science and medical background prior to starting the program, just to make that easier, because it was just, a lot of studying. I don't really have a huge downside. So but my life was different than a lot of other students. So I didn't have any children at the time. I didn't have kids until way later. I just have one. So that it was just me as a single person. So that was, just me to take care of.
Right.
So as far as the program itself, I really didn't have any concerns or issues with the program. Yeah, so I'm sorry, I don't really have a really good answer for that specifically.
But that's a good answer, I think. I mean, you would hope that there's not a lot of downside to the program, I would think. So yeah, absolutely. So was the program harder than you thought it was going to be?
I expected it to be a rigorous program. And so I came into it with that expectation, but my class, when I entered, I mean, my first quarter, I think my class was like 70 and we graduated with maybe 49. So there were a ton of my cohort that I think did not have that expectation. I think they did perceive that it was going to be an easier program than what they had initially signed up for. And when they had found out that, you know, this is a rigorous medical program, a lot of people kind of left because they weren't able to manage that in their life, or it wasn't the right time for them to be in that program.
Okay. Good answer, because this program is tough. It is tough. So as advisors like Jane and I have told every person that we talk to, this is probably the most challenging thing you will do. It's still that mindset in some students when they start that it's not as hard as you say it is, you know, but it really is. It really is. All right. So Alexandra, go ahead and ask your question.
Hi. I was just kind of piggybacking off of what Chloe had asked. How did you feel your experience at SCNM was with exploring different like modalities of the naturopathic medicine, like physical manipulation, different like facets like that?
Sure. I mean, to speak to that specifically, I wasn't really interested in doing any sort of physical manipulation. So I don't. I mean, you know, you just kind of do what you need to do in the program to achieve a competency there and be able to pass those board questions. But that modality specifically is something that I never enjoyed. So I didn't continue to utilize that in practice. So I have colleagues that do that and I refer out to them. I think you were probably speaking more broadly. So tell me,
just like do you feel like you were able to dip your toes in multiple different areas of becoming an ND?
Yeah, I mean, you know, when you sit for so we have 2 board exams, one after the second year and one, you know, after the completion of the program. And so you have to know that information to be able to you know, show a competency in that part of that program and to be able to pass your board exam. So yes, you definitely study that information, even though, you know, I knew I was going to never utilize that, you know, the physical manipulation stuff. So you definitely still have to study it and pass that. Yes. And I felt well trained there.
Okay. Good to know, because we do have a lot of alumni, not a lot. I mean, you have that whole tool belt available, but we do have alumni that focus on pain management or that manipulation or that physical medicine. And that's what they practice in their practice most of the time. So, and that's okay. That's okay.
Yeah. Yeah. The program lets you exit with lots of opportunity that can be specific to you. And then, yeah, if you don't want to do something in your practice, you just refer to your colleague that's really well versed in that.
Yeah. Yeah. Very good. All right. What other questions do you guys have that hasn't been answered yet?
Well, I'm not sure if it's been answered yet, but if you had the opportunity to do it all over again, would you still do the ND? Would you still, or would you just go a different direction? I mean, what was your ultimate goal in doing this?
Yeah, I would keep the same path. I really enjoy this field and I enjoy the way that I get to practice and all of the information that I have. So I don't think I would do something alternatively, but that, again, that's just me. So I love spending more time with my patients. I love being able to give patients more options. So, you know, I'd like to talk about what is evidence-based and then, you know, what there might be some anecdotal evidence for and where there's space to play around with those things and utilize lots of options. So yeah, I don't think I would go a different direction. I enjoy this career.
Very good.
Okay, thank you.
Dr. Shiffler, do you have patients that, say, for instance, are on quite a few pharmaceuticals and you need to try to get them off pharmaceuticals and they're kind of rejecting that? You know,
I would say that's not ever a scenario of mine. It's usually the other way around. It's always the hypertensive patient that refuses to start an antihypertensive medication.
Gotcha.
And they want to do something more natural, but there's a space where the natural products aren't going to touch an uncontrolled hypertensive patient. So I would say it's never the other direction.
Okay.
But with that being said, I mean, if you have a type 2 diabetic who works really hard at improving their A1C and is very strict at controlling their glucose values, and you get them back to a non-diabetic range, yeah, you can start to reduce their medications or take them off of that medication. I mean, that's always a possibility.
Okay. And I'm sure they're definitely open to that as well, to
Yeah.
go off medication.
Again, the other benefit about having more time with patients is that you get to talk to them about your concerns and, you know, what uncontrolled hypertension can do in the future. And, you know, it's not like another more conventional visit where they only have like 10 minutes of space to kind of relay that information. Because when patients have that experience, they basically feel like they are told, here's a medication, you know, just take it and we'll check back in. But
Yeah.
when I get to speak with them, I get to say, here's what we need to do to prevent X, Y, and Z in the future, you know, and this is why you're on this medication.
Okay. Very good. Very good. All right. Madison asks, do you feel that you have flexibility, freedom in your everyday life for things such as family and children, even while running your own practice? Good question.
Yeah, which is another reason why I wanted to open up my own practice. So not only did I just want to focus solely on patient care, but because I'm a mom, I can take the day off if I need to, and I can adjust my schedule based on my daughter's schedule. And so yes, that's absolutely a benefit. So I have no boss to answer to except for myself and my partner.
Wow.
So if I need to change my schedule to align with my daughter's schedule, which luckily she's 6 now, so illness frequency is a lot less. But I have the flexibility to do that. Absolutely.
Yeah, that's absolutely, that's fantastic. Did you participate in doing research at SCNM? Is there a required research component at SCNM for graduation?
Ooh, that I don't know about the requirement for research.
I don't think
but
there is a requirement.
you do there's like a course that you would work with Dr. Langland. I mean, so when I was a student, we didn't have the research center that they do now. So we were just kind of working out of our small little lab space. So in my time, there wasn't a requirement. But
Right.
yes, I did work with Dr. Langland and some students. And part of my time, we, you know, doing a bigger research study on like we were plating bacteria and looking at herbs and if they were, you know, lethal to bacteria. So I think that was kind of a long study, but I was a little part of that. And yes, I do highly recommend being involved in that piece, and especially now because there's more of a research center, absolutely being involved in that research, because that's great information and it would make your application for a residency stronger.
Oh, good to know. Good to know. And for the curriculum now, I do know in quarters 1, 2, and 3, you are required, there is a research class that goes on that you are required, that's part of the curriculum. So, and then I do know that, you know, if you want to pursue that further, then you have the opportunity to volunteer your time to work with Dr. Langland and his group of students. So that is a possibility. Yeah.
I want to go back to Chloe's question about
Sure.
financing. So that was kind of somewhat of a hurdle. So with financing to open up my own practice, because I'm a naturopathic physician, there were less options available to me, but we ended up with a SBA, small business loan. And so there was a few hoops we had to go through because I'm a naturopathic provider. I think funding would definitely be more readily available for other types of credentials, so the MDs and DOs. But overall, it was fine, and we were able to obtain that financing.
Wow, I didn't realize that. Wow.
But yeah, I worked with a great broker. They were able to they found a bank that would easily work with us. So it worked. This also was in the time of COVID, so that kind of probably made some complexity there as well.
Yeah, that had some issues to do with that too. Are you in Chandler, or what part of Phoenix are you in?
Yep. Yeah, we're in Chandler.
Okay. Very good. Very good. What other questions do you guys have? I think she answered all of mine.
Yeah, if there's a question you have where you're not really sure this is the path you should take, definitely ask me.
Yeah, she's been in practice for 10 years. That's a long time.
Well, Well, I don't have a question, but I do have a comment. I'm really grateful to hear from someone who's doing women and children's health, but also as a primary care physician, because I know that's an area that I've seen a great need, especially for maternity health and well-being for women and for babies, because honestly, they're not necessarily getting it.
Mhm.
And having that extended period of time where you can talk to them and talk them through that fearfulness and their own health and well-being, I think is really super important. So
Yeah.
thank you for that, because I know it's challenging. 10 years is very challenging no matter what business you're in, but being a doctor is a big deal. So
Yeah.
thank you.
Yeah.
Sure.
Absolutely. And Tejal asks, are most of your are most of patients covered under insurance?
Yeah, so this is also a little difference about Arizona in general. So in Washington and Oregon,
Mhm.
I think the naturopathic providers there can actually take Medicare and Medicaid. That is not the case here in Arizona. So currently, I can only contract with one insurance, and that is Cigna. So I'm only contracted with Cigna. So the majority of my patients are on Cigna, but I've done
Okay.
pay patients as well.
Got it. So even labs, is that just Cigna as well?
It would just be the office visit. So the lab company is the one who's contracted with the insurance. So we utilize like LabCorp or SonoraQuest.
Okay.
So I do a blood draw here. I send out the specimen to the lab, and
Got
that is what's under their insurance. But if they're on Medicare or Medicaid, they won't accept that order
Wow.
because I'm a naturopathic physician. But that's specifically in Arizona.
Okay.
So a different story if you're wanting to practice in Oregon and Washington.
Wow. So I'm going to ask, so being a student a while ago, what advice can you give to, like you had said earlier, some of these students have, been accepted. Some of them are working on their application. Some of them have already deposited and secured their seat for either spring or fall. So what kind of advice can you give to them as far as getting ready to embark on this journey?
I would probably encourage listening. I don't know if you're a big podcast fan, but I would encourage listening to a bunch of medical podcasts in preparation to get you really excited for the program. It'll
Okay.
be a few years until you can interact with patients in that way. But just starting to listen to those medical podcasts would probably get you excited, maybe help find a focus for you. And that might be supportive for your education in general, because you're initially the first 2 years, it's just going to be a bunch of just science classes, micro, your anatomy. You're not going to see patients or do patient care, which, I mean, if you're really motivated, you definitely can shadow someone and get that information or that experience. But I think that starting to listen to medical podcasts might be a great thing in order, to something to do before you start the program.
A good idea. Good idea.
I'm a huge fan of the Cribsiders and Curbsiders. Those two podcasts. So the Cribsiders is the pediatric focused podcast, and the Curbsiders would be the general medicine. There's a ton more, but those are my top two favorites.
Can you put those in the chat so that they have that? So that way you guys have that.
Yeah, there's a lot more that I listen to, but these are pretty good.
Okay. Cribsiders and Curbsiders.
Yeah, so the Curbsider would be like you're talking to another clinician about a clinical case, you're on the curb, and then the Cribsider, they just use that term because it's the pediatric podcast. They also have that group, they have a third one that's like they just like answer random medical questions. That's kind of fun. I think it's called The Curious Clinician.
Oh, interesting.
So you can find that one as well.
Are you guys all big podcasters?
Like outside of that, really just rest, organize
get
your
lots of sleep
because yeah.
You won't get much once you start. No, I'm only teasing.
But yeah, I mean, if you have the time, like definitely try and find something that would organize you. As far like academically, I used Evernote throughout my 4 years because I'm a Mac user, so I didn't do the OneNote, but
Okay.
finding something like that. There's a guy, I think the website's called Skillshare. And it's like a website that has a bunch of videos on just skills that you can learn. And there's an individual there that focuses on organizing your computer, look, it's a great resource for students in general. So that would be something I would do if you have the time before your program.
Okay. And those of you who are starting in spring, you still have a couple months.
Yes.
And those of you who are starting in fall, you have quite a few months. So this is some good tips here that you could take advantage of. Skillshare.
I think the website's Skillshare. There's a subscription base to it, but I think you can get like a free trial.
Oh, okay. Okay. All right, let me go through these questions. I just want to make sure that I asked all of them. And then, okay. Okay, I asked that one. It looks like I asked that one. I wish this would mark off the chat once I ask the question, but it's not that easy. I don't know if I asked this one. How did you gain knowledge of how to conduct your own business?
Well, that's a good question. I guess that would be one thing that I felt like we weren't super well trained on in our program, would be starting your own practice. So a lot of outside, gaining a bunch of outside knowledge is what you have to do. And so I kind of just was slow to put things together, and just over time learned how to do things. I don't really have a good resource there. I have other colleagues that are in private practice, but they have a different type of model. Like a lot of them do aesthetics. And so just kind of talked with them, and
Okay.
a lot of my own research.
Okay.
So no good one answer for that.
And then really
As I go.
On that same timeline or that same information, Alexandra, I didn't see your question here. So she had asked, can you describe your journey of opening a private practice, overcoming challenges with recruiting clients, creating a strong of medical professionals, building a business, etc. Like, where did you get your clients, your patients?
Yeah, well, so before contracting with an insurance company can take a long time, because you first have to become credentialed, and then they have to send you a contract, and that can all take a long time. Luckily, when I was in my residency at the college, I was already contracted, credentialed and contracted with Cigna. And so that was easy for me to switch over. But that did still take some time. So when I first started, I wasn't contracted with insurance. And so the marketing there, we had to utilize a company that can assist with marketing. So really, the internet is a lie. And so we utilized a company that helps optimize our search engine. So if someone were to search like primary care doctor in Chandler, I pay that individual to help put me up on that front page of Google.
Gotcha.
That's what everybody has to do. So,
Okay. Okay. Okay.
So basically a lot of search engine optimization. So I pay a marketing company to help with that, to hopefully get people in so that when they're even searching for us, that they'll find us.
Got it.
Yeah, so that was a lot of it. And then now being contracted on Cigna, a lot of people look for providers in their insurance website. And so I think they find us that way as well.
Gotcha.
Okay.
Kind of one question going with that. I'm not super familiar with insurance by any means. So essentially you had to get contracted with a line of insurance. Did the other, or was it your company that was,
It was originally myself, because I was already contracted. My practice is only just now contracted, and we've been open for a year and a half, a little more than a year and a half.
Okay. So with other, physicians at your practice, are they all independently contracted by the same, under their own credentials, they're contracted, or does the company kind of take everyone under?
So the two that do integrative oncology, I don't think that they're really interested in being on an insurance plan at this time. So the other person in my practice who is a primary care provider, we're trying to get her contracted, but it takes 120 days. So
Okay,
we
so everyone individually has to.
Mhm.
Gotcha.
Yeah, so
And
our
does it have to be
practice is now. Oh yeah. So our practice is like as in like within the last week, our practice is now under contract with Cigna, and so I can add providers on, but that takes 120 days.
So
Got it.
congratulations. Thank you for that help.
Mhm.
Awesome. All right, we have a couple more minutes. Any last minute questions from anybody? Is there anything you wish you knew before applying to med school and or pursuing medicine?
I mean, just more science, really. Just more clinical information would be great because that would just make your job so much easier to just
Okay.
easily have that information come to you. So
Okay.
yeah, outside of that, not really. But I guess I would say you need to know that this is a passion of yours because it takes a lot of work.
And
I have a lot of colleagues who, well, I have, there's a lot of naturopathic providers that might not, in my mind, practice appropriately, and that hinders some of our licensure. So if you come into this profession, you have to be pretty passionate about it and also want the profession to pursue forward in a positive way so that we can open up our licensure. We can be accepted under Medicare and Medicaid.
Right, right.
But going through the program and if you get a residency, which I hope you do, you'll be confident in that training and you will be able to trailblaze us forward.
Awesome. And that's the key. All right. Very good. All right. Nothing else, you guys? You got all the information. You're ready to go, right? All right, Dr. Shiffler, thank you for taking the time out to talk with us. This was very informative. That's about it. All right. You guys have a good day.
Yeah, good luck,
right.
everybody.
Thanks.
Thank you.
All right.